Okay, here we go with week 10. This is week 10, getting into transfers this week, along with some issues around core and some important stuff around the pelvis, especially in relationship to wheelchairs, how to position somebody with issues around their pelvis and their trunk. This relates to your wheelchair assignment. Okay, so part one here is the trunk, the hips, and knees, core, and I'm talking some about how this relates to Stacy, the story for this week. Here's the lecture questions. The first lecture question, why is the trunk crucial to function? This is kind of answered with this one. It provides that proximal stability for that distal function. So here's the core providing her stability, getting the distal function, which is wiping down the window there. Here's some of the terms around the trunk. There's trunk flexion, she's like flexed posture. Trunk rotation, she's rotating her trunk. Some basics of manual muscle testing. We won't be testing you on this, but just kind of FYI around trunk extension, all those spinal extensors. Trunk flexion, this is how you measure it. The rectus abs and the obliques play a huge role in trunk flexion. She's coming up. Trunk rotation, you have those internal and external obliques that help you rotate your trunk. These are key things to know clinically. You're working with kiddos, you're going to be dealing with all this core kind of issues a lot, doing a lot of gross motor, fine motor activities. A lot of crossover with OTs, with the upper and lower body, treating the whole person. You'll see this also with adults around stroke rehab and stuff. You'll be dealing with issues around the core to get the core stronger so they can do activities of daily living. Hip flexion, he's flexing his hip up and she's extending it. This is extension, this is flexion. He's flexing his hip as well. Iliacus and psoas are the big flexors, extensors, the glutes, and those bicep femoris, mostly the glutes. The knee flexion extension, he's extending his knee, the rectus femoris, the quads, then he's flexing all the hamstring muscles, flexing the knee, FYI kind of stuff. A trunk assessment, how do you assess somebody's trunk? Like I was talking about with children, this therapist is working on her core. Big issue here with the therapy ball, working on the core. How do you assess that, especially with an adult? Can they stand on one leg? Can they touch the floor on one leg? Can they go on all fours and keep their trunk up? Can they go on all fours with just one leg? Can they go on all fours with the opposite leg, the arm and the opposite leg out, so one arm and one knee on the mat kind of thing? You visualize this. Basically, how do you strengthen the core? Just all these different motions, the flexion, extension. So kind of, if you're working on her core, you'd ever kind of come forward and back, lateral to this one side, to the other, rotating, doing some rotating activities. Resistance. So I want you to hold yourself right here. I'm going to be pushing on your chest, try to hold yourself up kind of thing. Have them do activities, tossing balls, and all that sort of thing. We'll do some of that in the lab to get a sense of what I mean by core assessment and treatment. Okay, so let's kind of relate this to Stacy. Stacy's the one in the story had really, really severe diabetes. Diabetes is probably the one diagnosis you'll see more of than any other in rehab. This has this cascade of issues related to diabetes. Their vision leads to heart attacks, strokes, and peripheral neuropathy, which we've talked about, loss in sensation in their distal extremities. What happens a lot with people with diabetes, especially as the disease progresses, if it's not under control, is they have amputations. She's got bilateral amputations here, as Stacy did, above the knee bilateral amputations. So with Stacy, she was also on, diabetes also attacks your kidney function. So she was on dialysis, very, very weak, and she had the amputation, so she had no legs below the knees. So seeing her in the home, she was just really, really weak. and we were trying to build her up for her prosthesis, for her fake legs on both legs, so she could at least transfer with less assist, if not walk again. So one of the things I was working on in her home was her core, getting her core stronger. So think about this stuff. How could we treat? How did the therapist treat her core in the home? And there were a lot of simple activities that you can do to work on somebody's core. You can simply have them sit on the edge of the bed without support. Can they sit on the edge of the bed without holding on? Or just one hand holding on? They can do that. Can they do activities on the edge of the bed or on a mat without support? It could be something very simple, donning a blouse, brushing their hair, brushing their teeth. Can get more involved. I had her playing cards. So she would sit on the edge of the bed. She liked to play cards. So she would sit and she would be playing cards. So she couldn't hang on when she was playing the cards. And she'd be reaching out of her center of imbalance for the cards. So that's kind of the way we're working on core with her. Doing similar stuff with adults, other adults, or children, doing games and activities on the therapy ball, like that little kiddo you saw the picture of, playing cards, whatever, engaging their upper body. Just having to hold themselves up is challenging. Then you could have them forward and back, side to side, like we talked about. It was impacting her function in the sense that it was impacting her ability to transfer, sit on the edge of the bed, and do anything. She was just flopping over. She needed support to do anything. And she's the kind of person, if she was in a wheelchair, and this is a hint if you have Stacy, she would probably need lateral supports on both sides because she was just so weak. If not, if she had a chair like this, in this image, she would just be falling over to the side. Her core, her trunk, her core was that weak. Okay, so let's